Winter 2025. 5 years after COVID first turned the world upside down, the virus is still here. No longer a terrifying stranger, but a stubborn guest who won't leave. We're all wondering, is another big wave coming? Or has COVID settled into something we can handle? The answer isn't simple. It's tangled up in new variants, how many of us get vaccinated, and whether we've really learned from the chaos of the past. Let's walk through what we know and what keeps experts up at night. Think back to 2020, empty grocery shelves, Zoom birthdays, and daily death counts. Today, life feels closer to normal, but COVID's shadow still lingers. Schools have air purifiers humming in classrooms, offices stagger work-from-home days, and rapid tests sit next to Advil in bathroom cabinets. We've adapted, but the virus keeps adapting too.
Well, new this morning, a new COVID variant rapidly spreading overseas is now expected to become the primary strain here in the U.S., maybe even before the arrival of winter.
Right now, COVID's playing a game of hide-and-seek across the U.S. In February 2025, only a couple states are seeing cases climb, while most are holding steady or even improving. That's a big shift from December, when nearly 30 states were dealing with rising infections. The culprit? A sneaky new variant called XEC. It's not deadlier, but it's better at slipping past our immune defenses, especially for older folks or people with health issues. Take Minnesota, where XEC cases doubled in 2 weeks, forcing nursing homes to limit visitors again. Meanwhile, states like Hawaii and Maine have barely seen a blip, thanks to high booster rates and strict workplace safety rules. COVID's become as seasonal as the flu. Winter and summer surges are the new normal. Places like the Midwest and South are seeing higher virus levels in wastewater, a sign cases might tick up again. In Texas, wastewater data from Houston shows viral loads spiking faster than last year, but hospitals aren't panicking yet. We've got better tools now, says Dr. Alicia Torres, an ER physician in San Antonio. But we're watching. But here's the good news. Hospitalizations are way down compared to the darkest days of 2022. Why? Because most of us have some immunity now, either from vaccines or past infections. Still, it's not all smooth sailing. Some cities, like Chicago and Seattle, are bringing back masks in hospitals. Others, especially in rural areas, are done with restrictions. We're tired, says a farmer in Mississippi, but that doesn't mean the virus cares. Scientists are watching the virus mutate in real time. There are over a dozen Omicron spin-offs now. The big fear? What if 2 variants combine into something worse? It's like chasing a shapeshifter, one researcher admits. In labs from Boston to San Francisco, teams work around the clock sequencing samples, but funding cuts have slowed progress. We're racing a moving target with one hand tied behind our backs, says a virologist at Johns Hopkins. Vaccines are still our MVP. By late 2024, nearly half of seniors and about a fifth of all adults got the latest booster. These updated shots cut the risk of landing in the hospital by over 70% for vulnerable people. But not everyone's on board. In places like Navajo Nation, fewer than 1 in 5 people are boosted. Distrust of the government and hard-to-reach clinics don't help. The nearest pharmacy is 90 minutes away, says James Yellowhorse, a tribal leader in Arizona. Gas costs too much, and the buses don't run out here. Compare that to Vermont, where community health workers literally knock on doors to deliver shots. We treat it like voting, says a local nurse. Every person counts. The stakes are sky high. Without vaccines, experts say this winter could have seen 150,000 more hospital beds filled. The shots aren't perfect, some still get sick, but they're buying us time. At a CVS in Denver, pharmacist Lisa Nguyen sees the difference. Last year, we had lines out the door for boosters. Now maybe 5 people a day. Folks think they're done, but COVID isn't. The future's looking brighter, though. New vaccines in the pipeline, like nasal sprays that stop the virus at your nose, could be game changers. Moderna's even testing a universal shot that might work against any variant. But until then, it's about using the tools we've got and making sure everyone can get them. In Detroit, a church group turned its basement into a 24/7 vaccine hub, offering tamales and gift cards to anyone who rolls up their sleeve. We've vaccinated 800 people this month, says Pastor Miguel Rivera. It's about meeting folks where they are. Hospitals aren't out of the woods. Last fall, COVID patients flooded ERs alongside flu and RSV cases. In Atlanta's Grady Memorial, nurses describe hallways packed with gurneys. It's not 2020, says an ICU doctor, but it's still brutal. Rural hospitals have it worst. In Wyoming, one small hospital's entire ICU team quit after burning out. We're barely keeping the lights on, their director admits. A traveling nurse in Nebraska tells me she's worked 18 straight days. I haven't seen my kids in 3 weeks, but if I quit, who's left? There's progress, though. The CDC's new tracking system gives real-time updates on outbreaks, helping hospitals prepare. Antiviral pills like Paxlovid work wonders if you get them early. Telehealth's also been a lifeline. I've treated more COVID patients over Zoom than in person this year, says a family doctor in Oregon. At Mass General, a pilot program uses AI to predict which patients might crash overnight, freeing up nurses to focus on the sickest. But old problems linger: staff shortages, misinformation spreading faster than the virus itself. I had a patient refuse Paxlovid because TikTok said it causes cancer, sighs a nurse in Ohio. We're not just battling a virus anymore. We're battling fear. In Texas, a hospital administrator confides, "We're training custodians to take vital signs. We've got no choice." The human cost is everywhere. A nurse in Chicago breaks down describing a 30-year-old father who died alone because his family couldn't visit. "We held his hand," she says, "but it's not the same." COVID doesn't care about borders. The XEC variant popping up in Europe? It's here now. Countries like New Zealand crush their COVID numbers with aggressive vaccine drives and smart tracking. "We treated it like a team sport," says a health official in Auckland. "If one person's unvaccinated, we're all at risk." But in places like Malawi, only 1 in 10 people have gotten the latest shots. That's a breeding ground for new variants. At a clinic outside Lilongwe, Dr. Grace Banda shows me a fridge with 3 doses left. We'll run out by Friday, then what? China's flip-flopping on COVID rules caused chaos after Lunar New Year. When restrictions lifted, cases exploded. Hospitals in Beijing turned away non-emergencies for weeks. India's cases are high but manageable. Their mix of natural immunity and vaccines is working. "We've buried too many," says a Mumbai doctor. "Now we're fighting smarter." Meanwhile, the World Health Organization keeps begging rich countries to share more doses. "We're all in this together," says their director, "whether we act like it or not." In Brazil, a new variant popped up in the Amazon, sparking panic. "We've got no ICU beds, no oxygen," texts a nurse in Manaus. "It's 2021 all over again." Companies are stepping up too. Google gives paid leave for long COVID. Delta Airlines brought back masks on long flights. Small fixes maybe, but they add up. At a Ford plant in Michigan, workers voted to keep pandemic safety rules. Staggered shifts, free N95s and air quality monitors. "We lost too many colleagues," says union rep Carla Mendez. "We're not going back." The bottom line? COVID's here to stay, but panic doesn't have to be. "We know what works," says a CDC expert. "Vaccines, clean air, looking out for each other. The rest is just noise." In New York, a subway ad puts it bluntly. COVID's not over, but neither are we. 5 years ago, COVID taught us how fragile life is. Now it's teaching us how to endure. The road ahead isn't easy, but we've got the tools and each other. Let's not forget the biggest lesson. When we come together, even a virus that reshaped the world doesn't stand a chance. Look at the kid getting her shot, the scientist logging another midnight shift, the neighbor dropping off groceries for someone too sick to leave home. That's how we'll write the next chapter, not with fear, but with stubborn, everyday courage. Thanks for watching. If this got you thinking, hit like, subscribe, and ring that bell. Let's keep the conversation going, because the best way to beat COVID is to face it together.